Together we achieve victory over heart failure.
Hello and welcome to our podcast. I am Dr. Lijo Varghese, working in KMCH Medical College, Coimbatore. And today we are delving into a silent epidemic that India is combating, that is heart failure. In India, the majority of patients grappling with heart failure are surprisingly young individuals. It's a common occurrence to witness young adults seeking medical assistance for heart failure, unlike the Western countries where heart failure is predominantly a disease of the elderly. Now, let's break down 5 essential insights on heart failure. Firstly, what does it mean when a doctor tells you that you have heart failure? So, when people get a diagnosis of heart failure, they think it's the end of their lives. The term heart failure can be misleading or frightening, but it simply means a heart is struggling to pump blood to meet the ejection fraction, or EF, is one of the ways by which the doctors measure the heart pumping, and this will tell you the percentage of blood that is pumped out. Please remember that the normal ejection fraction is not 100%, and ejection fraction of around 60 to 65% is normal for an absolutely healthy individuals. And when it is less than 50%, you start to have LV dysfunction or symptoms of heart failure. It becomes severe as lower the EF, more the severe the symptoms. An ejection fraction of less than 30% means very severe heart failure. Secondly, why are there so many Indians affected by heart failure? So genetics play a significant role. Diet, lack of exercise, obesity, these are all the things which make the patients more vulnerable. And of course, more Indians are likely to have hypertension, diabetes, and smoking habits is also important. And therefore, more of them are likely to have heart attacks and therefore end up in ejection fraction being low and therefore ending up in heart failure. Moving on, what are the signs and symptoms of heart failure? You watch out for confusion, fatigue, heart palpitation, nausea, shortness of breath, inability to sleep flat at night, waking up in the middle of the night with breathlessness, decreased appetite, vomiting, and generalized fatigue or tiredness. So these are all the symptoms. Patients also may have swelling in the abdomen or swelling in the legs. How can we protect ourselves from the disease? Our heart works incredibly hard to keep us alive. These are 5 golden rules which you can follow to have a healthy heart. Early detections of heart failure through regular blood tests and ECG, X-ray, and echo. Dietary adjustments to maintain heart health. Incorporating daily exercise into your routine. Practicing stress management techniques. Quitting habits like alcohol, tobacco, and smoking. Lastly, what comes next after a heart failure diagnosis? Thankfully, medical science offers numerous treatment options. It is possible to lead an absolutely normal and healthy and productive life even if you have LV dysfunction or a low ejection fraction. Heart failure medications improve quality of life and longevity, decreases the death or mortality, and decreases the chance of recurrent hospitalization. You need to take the drugs as prescribed by your doctor and do regular blood tests and to be in regular follow-up. Now, devices like biventricular pacemaker, implantable ICD, cardioverter defibrillator, and heart valve repair or replacement are also in the pipeline and can be done. But patients with intractable or refractory heart failure, there is a last resort of option, which is heart transplant, which is quite expensive in our country and out of reach for many. The lifetime risk of heart failure is 1 in 5 for both men and women. Remember, awareness and proactive measures are the key in combating the silent epidemic. Thank you.